This is a gynecological ultrasound that of a 38-year-old female. What we are seeing is the longitudinal section of the urinary bladder, the vagina, the cervix, and this is the anterior lip of the cervix, this area, from here to here. This is the anterior myometrium, and this is the anterior lip of the cervix, this area. And below this area you will see mixed echo mass, which is in fact a fibroid that relates to the posterior lip of the lower lip of this area. See, now in transfer section, this is the uterus, and down when I move the probe inferiorly, I see the mass again. Now, in fact, this is the fibroid. It's quite a large fibroid, and it's protruding into the you see this, it measures 12.3 centimeters in length and 6.5 centimeters in anterior posterior diameter, and this is the anterior lip of the cervix. This is the uterus. This area, this is the anterior uterus. The myometrium is compromised. The size of the myometrium in this location is very much compromised. And she does not give. It's a pedunculated fibroid. You see this part up to here. From here to here, it relates. It's intrauterine, and from here to here, it's extending in posterior inferiorly, and it's a pedunculated fibroid. Now another thing to note is that this is the uterus seen high above, just below the umbilical region. This is the uterus, and you can see that the whole length of the cervix is elongated by the pressure of the mass effect from the fibroid below. This is the fibroid, and you see it's weighing approximately 10 by 6.3 centimeters. This is the uterus, and she has no complaint of menorrhagia. Uterus in longitudinal section. This is the longitudinal section of the uterus, and this is the endometrial canal. This white line that you are seeing is that of the endometrial canal. In early proliferative phase, this is the fundus of the uterus, anterior myometrium, posterior myometrium. However, from here onwards, the anterior myometrium, thickness of the anterior myometrium is compromised. So this is again a fibroid relating to the posterior wall of the, it is pedunculated, and it's, you see, this part is intrauterine. This is the pedunculated part, and which is extending posterior and inferiorly. Elevating the uterus. Now this is the uterus elevated. This is the urinary bladder, and the elongation of this lower segment of the uterus along with the cervix is because of the pressure from a mass which is a fibroid posterior to the now this is the myometrium, anterior myometrium, which is encircled And appearance of the fibroid is very much mixed, aqueous, cystic and solid. In this area you can see it is measuring approximately, again in this scanning plan, intrauterine part of this solid echogenic mass, mixed echo mass with internal cystic areas. You can see this is a cystic area, this is a cystic area. Similarly, these are a few other cystic areas within it. And this is the uterus. This is the uterus. Anteriorly is the urinary bladder. And this we are seeing in the transverse section. And this is the fibroid with areas of internal degeneration, necrosis. So this is in fact a case study of uterine fibroid, elevating the uterus anteriorly and stretching it so that I am seeing it just at the level of the umbilicus in the midline, and the rest you can see it's extending and expanding. This is all fibroid, this is all fibroid. And when I align the uterus with the vagina, you can see it relating to the posterior lip of the cervix, which extends again posteriorly. You see this is extension of the fibroid posterior-inferiorly in a patient age 38 years. This is the fibroid portion of the now this is the uterus. This area is the uterus in longitudinal section. This is the longitudinal section, and this is the urinary bladder. This is the posterior myometrium, anterior myometrium, rest. This is the anterior lower segment anterior myometrium. This is the cervix. This area is representative of the cervix. This is the vagina, and you see that there is a large fibroid extending in posterior-inferiorly from the posterior wall of the uterus, and not only that, it involves the posterior lip of the cervix as well. So any region that relates to the posterior lip of the or the cervix is always dangerous, should be removed immediately, because they have the potential to develop into some aggressive pathology. Now this is the cystic area. This is the cystic area which is seen within this solid echogenic mass, which is the fibroid, a large fibroid relating to the posterior wall of the uterus, elevating the uterus anteriorly, stretching the lower segment as well as the anterior lip of the cervix, involving the posterior lip of the cervix with areas of internal degeneration and necrosis, having mixed echo appearances, solid as well as, echogenic, hypovoic. This is an echogenic part, hypoecheric area. So this is our case of the day. Thank you very much.